CHAF brings together local people from across Dundee to ensure that communities are effectively and meaningfully involved in decisions that affect their health and well-being.
It's helped me find my voice again, and it's helped me find me again, and it's a big part of my life that won't stop.
Coming to groups like this helps you see what is actually out there.
It's always quite daunting going into a place where you don't know anybody, but we've really gelled, as a team.
Good bunch of people. I only knew one person in the group when it started. I mean, we're all together, it's good.
The group meets regularly to address their learning needs and to discuss the priority issues that they're hearing about in their own communities. So they're a really consolidated group with good relationships.
Before becoming a CHAF member, participants work through a nationally accredited course called Health Issues in the Community.
Coming along to the HIT group, we're trying to show people that when it's not just one voice, when it's a lot of voices, things can change. You can make a real difference. So they go over things about what is community development, all the different types of poverty there is, participation, lots of different things.
Just discuss things that are going on, like poverty and lack of housing, equality in health and things like that.
I never thought I'd get my voice heard before, but I've learned a few things about poverty and stuff like that, so it's been good.
The connection between HIC and CHAF is that it's raising awareness about issues and concerns that people have within their communities, and the group of people who are doing HIC, because they're doing this, they really want to go on to another level, and the next progression for them was to join the CHAF group.
Resolve and Evolve is a recovery group based in the northeast of Dundee.
So Resolve and Evolve, this was a long time coming. We always wanted something for people to come where there was no judgment, where they could just come even if they were wanting to have a chat, or if they were wanting to do something further, or if they wanted training, or even just an ear, just somebody to sit and listen to them.
4 members of Resolve and Evolve sit on the CHAF group, so they're kind of bringing up the needs of people that they're seeing at their drop-in. So people in recovery that are saying we want more than the methadone programme, we want support, we want really to have hope and choices in our life, they're feeding that in. So they're really providing a voice for people that are really very marginalised and often didn't get their voices heard.
I really enjoy being a CHAF member. Figuring out, we're different areas at Dundee, to come together and see what one end does different to what we do, and then we could do some things different from what they do, and then I don't feel restricted with CHAF, because a lot of things like that, it's you have to leave your kids at home, have to find a babysitter, and then I don't get to put my input in, but I'm quite lucky because I get to take Luna everywhere with me.
And this is the youngest CHAF member, this is Luna.
So I then do get to put my input in and then make our community better for when my children are older, and that's what we need.
The Menas Hill Food Hub is run from Menas Hill Community Gardens twice a week.
I joined the CHAF group through the Health Issues in the Community group. It's been amazing. It's been a big part of most of the work that we've done. It's given me an insight into what issues are out in the community and what we could do to help them combat the poverty stuff that's going on just now. This is the larder that we do in Menas Hill. It's really busy every time that we're open. Anything that comes up in the community that we think is a big issue, we could take to the CHAF group. And if it's something we could deal with, then we'll deal with it there. If not, we could signpost it to the right people that can deal with it.
So we have really active partnerships with all key service providers around health and wellbeing.
At these groups, what we get is the experiences and the stories of people who use these services. What happened to you personally, what happened to your neighbour, your relative. As a group, what are you agreeing that you think that we should do, and then you're informing the organisation. So you've got this sort of nested approach of the group, the individual and the organisation, and all of that trying to work together cohesively to deliver what the citizens of Dundee really want. The initial meeting with them, I was developing the GP premises strategy, and what we needed from that was some input from the citizens of Dundee, so we need them involved in the design of these strategies. So I got invited along to the group, and I went with Joyce and I met the members of the various groups and talked to them about the strategy, what we were what the GP's ambition was, and we wanted to see whether that aligned with what the citizens of Dundee had, and also with other strategies and plans that were in place, like the 20-minute neighbourhoods and things that have come out of Dundee City Plan. So it was to bring that all together and hear their ideas of what should a practice premise look like going into the future.
For me, there's a wider impact for the individuals who are actually involved in CHAF and the people that they speak to, because they are learning that they can influence planning and policy, and that they're not just a subject to the systems that are around.
And so at the CHAF meeting today we have a short report from the City's Suicide Prevention Coordinator, who's reporting back to them the comments that they fed in and how those comments have been embedded into the suicide prevention delivery plan for the city.
There is a walking group that runs from Maxwell Community Garden every Wednesday.
At the moment we've got 3 CHAF members who come along to this walking group, so they're really instrumental in making sure information's taken backwards and forwards between the 2 groups. A lot of good things are coming for CHAF, a lot of good people are reporting back good things when they're going to different conferences and everything. A lot of the conferences quite impressed how we're doing, and vice versa. So, and they're bringing back a lot of good information for the other places.
There's always something that I can bring back and go, oh, we learnt this. This is what we could put in place.
We live and we experience the city every day. Local people know what we need best for the city. So then we feed it to them and they feed higher up, to then feed higher up. So it all has to come from us.
It's a matter of social justice really, and inequalities are not inevitable and they're unfair. So I think it's absolutely crucial that we keep challenging our partners as a city to make sure that they are taking that unlevel playing field into account and absolutely doing something about that.
If you would like to find out more about the work of the Community Health Team, please contact cld@dundeecity.gov.uk.